Are you overwhelmed with caregiving for your patient or a family member? Do you know that right now AI is changing the landscape for caregivers too? Yesterday, I'm very excited because I do have a very special guest who's helping cancer patients and those caregivers of patients with chronic illnesses. I saw him at the Arab Health, and I'm very excited to bring him today to our episode. If you don't know me yet, allow me to introduce myself. My name is Wanda top 15 LinkedIn expert Dubai and number one most influential Filipina on LinkedIn. Every week we go live here on LinkedIn. Simultaneously, we are broadcasting live on LinkedIn, Facebook, YouTube, and Instagram because our goal at the Cancer Conversations with Coach Wanda is to share life-saving insight one episode at a time. Now, today, our episode is all about Evva Health's vision, how AI is transforming family caregiving for cancer and chronic illness. And of course, before I bring my guest on stage, let me talk about him first. Dr. Saurabh Vyas is the founder and CEO of Evva Health, a pioneering digital health company designed to support family caregivers in navigating complex care journeys using AI. With a background in healthcare innovation, tech strategy, and a human-centered design, Saurabh has worked with major global organizations like Deloitte, Kaiser, Roche, and several healthcare startups. He founded Evva Health after his personal experience with caregiving related the overwhelming gaps in support, coordination, and peace of mind. Today, his work is transforming how families approach caregiving with the help of AI and compassionate technology. Wow. So without further ado, let me bring my guest on stage. Saurabh, thank you very much for saying yes to this.
Nice to be here, and hope you're having a wonderful day. Thank you for inviting me.
All good. Now let's get it rolling already because when I was listening to you during Arab, I was like nodding my head all the time because every problem you said about caregiving is something I experienced. Personally, I was diagnosed with caregiver stress. I didn't know it was a thing, When I went to the doctor told me, do you want sleeping pills, Wanda? Do you want this and that? Because she's like, I don't think you're okay. And this is where I think I want to know the story. What's the story behind Evva's Health?
Absolutely. I think it's the inspiration of caregivers like you, right? There are millions of caregivers today across the world, and whether it's dementia, whether it's cancer, whether it's others too. I have been a caregiver myself for my late aunt who passed away with breast cancer, and a secondary caregiver for my mom who is a cancer survivor. And at the same time, as a clinician, I have seen so many people, whether it's family, friends, and others, always come to me for not just clinical advice, but also as a caregiver. So it's like, hey, what do I do? I'm helping take care of my loved one who's special to me, but a lot of my time is essentially spent on just everything else, all the decisions that need to be made, whether it is finding information or there's now a referral and where do I find the right physician, who's going to take my insurance. Oh, by the way, what does my insurance cover, or does it cover anything? And what is next? Like, I'm living so much in the moment that, suddenly things come up and like 3 months down the line, I don't know what to do. I'm not prepared for it. And so these were the stories, both personal as well as others, which kind of led to the conception of Evva. It's like, this shouldn't be so hard at the end of the day. There's information there, but it's not reliable. Or if there is information that it's reliable, it's just so fragmented. And so that was the idea of like, hey, how do we kind of like bring this to the caregivers rather than caregivers, trying to search for it and then like getting really overwhelmed at the end of the day.
Wow, that's really profound. I always love how founders create solutions from their own struggles and also now, bringing it to public. And I think I agree with you. There's so much fragmented solution in terms of cancer and even chronic illness, right? And I agree with you. There's so many problems that you need to take care of the moment that you're just concerned about the next right thing to do. Now, the challenge is that what's that next right thing? Correct. Be it the food that needs to be taken, the kind of medicine, treatment, everything else between. Now, sir, I know there are many gaps on cancer care, be it also for other of the chronic illnesses. Now, other than the fragmented solution, misinformation, what other gaps did you see as such?
Um, Several, right? Essentially, so like one of the major ones is like when usually we go to a physician, usually for chronic care you may have multiple healthcare professionals, right? You may have
Mm,
physicians, physiotherapists,
true.
you have different instructions from your oncologist, from your general physician, and whoever else, right? And so usually it is either a printed paper, or if there are EHR systems or a mobile app, it's a rough mobile app that health systems often have. And what do? You actually go home, whether you're a patient or a caregiver, and then try to make sense of it, everything, right?
Mm,
It's not just information, but like, all right, I've been prescribed these exercises and this medications. Where do I find them, or what's the best option for me? And then what should I be looking out for at the end of the day? And then you also like struggle to actually communicate all of these things that you identify
mm,
to the next physician. So when you are actually going into the next physician visit, most of us actually remember only the last 3 to 4 days of our lives, like in detail, right? And so like let's say if 3 months pass between visits, you will completely lose track of like what was happening like 15 days ago, right? Or a month ago.
mm,
Maybe it was very important for your clinician to actually make a decision of like whether some treatment is right for you, or maybe additional lab tests need to be ordered at some point in time. So that coordination is also
mm,
a major challenge. And then finally, it's also about like planning, which is again a big piece, right? As I was mentioning earlier, is how do you plan your finances? How do you plan legal,
true.
right? So whether it
Mm,
is power of attorney, whether it is like living will in certain cases, or advanced care directive, which basically means like, hey, do not resuscitate orders, for example, right? And so all of that, like if I don't know, if nobody has told me, I wouldn't know what to do. And actually there's
mm,
a lot of research which shows that physicians don't have enough time. They would like to, but either they don't have enough time, or I would say resources or understanding about you to tell
mm.
you like what you may need beyond this particular visit. And so this is where there is a lot of struggle in terms of both care navigation, coordination, and planning at the end of.
Mm. Wow. I think, I totally agree with that. The care navigation, the planning, there's so many pieces and puzzles that you need to understand, but you don't know where to start, right? Because either there's too much information to digest that you don't understand, and you don't even know how to communicate it, right? And getting the next right help is critical. Now, let's talk about how Eva Health is changing all of this now.
Absolutely. So we have a very different approach at Eva, where we believe like it's a combination of human touch as well as digital solutions, which kind of come into play to make this entire thing easier. So what I mean by that, right, is AI. We have been using AI actually from the very early days. We started with a very different form than what is right now available. And so the way we see it is human interaction is very going to be very important, but it
Mm,
cannot happen as frequently. And sometimes also what it lacks is the complete awareness about the situation and all of the data, right? Like all of us are like have limited capacity to kind of retain data at a single point in time. So that's where we are combining like that interaction with the AI, which keeps track of
mm.
all the things that are happening around you, what you may need,
Oh.
uh, how do I like make this simple, all of those things, right? So at the core of it, like how Eva works is you can simply take it with you to your next physician visit.
Mm,
And you either can use like our inbuilt voice AI companion, which acts like a care advocate. So it can listen into the conversation. It doesn't record the conversation entirely, it doesn't keep a recording, so it's private. but it kind of distills the key elements that it hears from that, whether it is medication, instructions. Just imagine, so you don't, like, even leaving out of a physician visit or a clinician visit, you don't
Yeah.
forget anything that was said which was important. Not only that, you can then simplify. So all of understanding, it simplifies based on what it already knows about you. So your insurance, your, like, your preferences, whether you're a caregiver or not, or you are a patient. And if you're a caregiver, are you stressed or not, right? So how do you digest it?
Mm,
Like, sometimes you may want more details, sometimes you
true.
are a person who does better with less details. So it knows a lot about this, and so it simplifies that accordingly as well. And most importantly, you don't need to always have the voice AI. If you don't have it, you can just, like, upload whatever documents and others, lab reports, whatever have been given to you, and it does a great job of actually kind of like helping you break it down into
Oh,
bite. And as it's doing this, most importantly, it's also keeping a track of, like, all right, what is happening over a period of time, right? Are there
mm,
things missing, or are there things in your insurance document, like what is covered, what's not? So it's also kind of like giving you that information. Let's say a physician prescribed some physiotherapy, and
mm.
parts of the physiotherapy, only, let's say, 10 sessions are covered. Now it can actually proactively tell you that, hey, this is covered, this would be your total bill, without you having to try and figure out, like, that. And this it does instantaneously, like literally within a couple of minutes of the visit ending, or during the visit in some cases, if you're willing to wait a minute as well.
Wow, that's amazing. So are you saying that you can upload any information and it can digest it for you? Meaning you can upload the lab reports, you can upload the insurance, any, voice notes, and then it can make sense of this is covered, not covered, what the lab, there's so many laboratory reports that I cannot make sense. And I know the doctor also don't have time to explain each and everything, right? They only explain what's above normal or below the normal. So it can even give you that granular detail also, right? Am I correct?
That is correct. And it can actually also suggest some of the things that you may want to watch out for or consider. So going a little bit beyond, right, in terms of not just what it is, but all right, what should I do, or what should you do based on that piece of information? Whether it is like even things like, oh, maybe you should ask a question to your here are the questions you can ask your clinician next time when you visit, or maybe this is what you should do in terms of taking care of that based on what the what a clinician may have already said, but you just don't
Mm.
remember at this point in time as well.
So about just a question, can it also handle, like, for example, food? It's so difficult to think of what's the right food for, any person with this kind of chronic illness to eat, what to avoid, not to avoid. Is the app covering that too?
Yes, it can definitely. So the more you interact with it, the more it learns about you, like the conditions you
Mm.
have, the medications you may be taking, even the medications you were taking, and why they were stopped, for what reason. And so this is where it shines the most, where it doesn't have the limitation of, like, just knowing about like your relationship with one clinician, but like knowing about, like,
Mm.
let's say you're going to 10 different physicians, one for endocrinology, maybe you have diabetes, maybe you have a cancer at the same time, maybe you have a general practitioner. So it knows all about this, and then keep it straight in terms of, like, all right, based on like what, let's say, a cardiologist said or what your oncologist said, here is, and your food preferences, maybe you don't like to eat, let's say, certain types of meat, or you don't eat meat, then it can also kind of guide you accordingly and make sure that it
Wow.
always kind of gives you advice or actionable, like, support that is
Mm.
tailored to you specifically.
Wow, that's good. Now, Sarah, can you give like a few examples how Eva Health is transforming both, the lives of caregivers and their patients too?
Absolutely. And so we have been in the process of now launching it and starting to launch it for the larger audience. So we've had a couple of pilots with key nonprofit associations in US. So I was just talking to one of the associations we are partnering with, which will provide the human touch to cancer patients or cancer
Mm.
warriors. Strive Michael. And so they are focusing primarily on lung cancer patients, for example. And they were blown away in terms of their pilot, because now their human coordinators essentially can take it and interact with that along with the family as well as the cancer warriors. And so there was one gentleman whose caregivers were like really frazzled. Again, these are well-to-do families, educated,
Mm.
and so they feel that they knew, but they were struggling with like basic things around like, what do I ask the physician? And so
Yeah.
they took Eva with them one of the visits. And Eva actually, very in 30 seconds, it ended up after the visit, like, creating that report and kind of calling out, like, here are the three questions you probably forgot to ask. And
Mm.
they were so impressed because, like, that person, for example, like, they had never thought about those questions ever before. And so they're like, oh my God, like, I had never asked. And when they did, the physician was actually impressed. I'm like, oh, we haven't covered that. I'm glad you asked. So
Mm.
that Eva kind of filled in that gap, right? Almost as a partner to the caregiver in that scenario. And so since then, they've been using it very regularly. They feel it's more, trusted place, because one major thing they have loved about Eva so far is that there is always a reason behind the answer. So unlike your
Mm.
Google, unlike your Chat GPT, we don't like take information from everywhere. We only take it from sources which are curated and trustworthy. So they have been validated that they are the great place. And by the way, your physician can also control which documents, where the knowledge is coming from. And so we always like kind of share, like, okay, this is the document, this is the link, this is whatever, where the knowledge is coming from. And so if you have some questions, you can continue to interact with Eva, or also do your own research. And that is something which is very unique as compared to others, and that's something that has been really gelling well with them.
Well, I love that, another human intelligence, right? I think as a caregiver, there's so many things in your mind already that you just want to have minimal information, right? But if somebody can do the thinking for you, what's the right question to ask the doctors? How do you look at these things? That will be a true lifesaver. Now, I think my next question, Saurabh, I know there's so much AI now, and I think it's both. There's pros and cons. Like, for example, sometimes if I don't understand things, I can even upload that report in ChatGPT and say, interpret this result for me, right? But I know there could also be harm in doing that, because that itself is not a health tech app. It doesn't understand. What are the do's and don'ts from your experience with the kind of how technology is evolving now?
I'm glad you asked, because tech is evolving, particularly AI. We see now AI everywhere, right? And there's so many solutions in different realms. But at the same time, it can get overwhelming in itself as you kind of navigate like which one I choose. There are a couple of different things as people kind of like start interacting. So one thing I've noticed, the biggest one is how confidently AI can sometimes have misinformation, right? And
Mm.
so and this is something of a problem. So if you go to Google, one of the biggest problems is Google's websites and results, for example, even including their new AI, they are and Perplexity and others too, they're all curated by SEO, indirectly or
Oh,
directly. What that
yeah.
means is like
Mm.
websites which kind of like have that SEO power, they may not be fully vetted. Sometimes the information, depending on what you're asking, if it's general, yes, but if not, then it may not actually know what exactly is the right answer. And so it may give conflicting ones at the same time because it's
Mm.
pulling in that information or training from a different place. And then the same goes for ChatGPT, because these are general models. All they are doing is kind
Mm.
of like predicting what words come in which order. And so what they lack is this, what I was mentioning earlier, is this traceability of like, what is the knowledge? Is the knowledge sound? Or is it something that, is just general, right? Like gibberish, it includes the gibberish, a lot of gibberish as well. The second piece is, as people like navigate this, so have that questioning attitude is like, am I looking at it like, let's not trust it at face value, right? I would say
Mm.
like for whatever reason, like any AI solution, right? Like whether it is Google, ChatGPT, Perplexity, or others, that you have to be watchful in what they're saying. It may be very confident, but you may, unless you are sometimes like, asking follow-up questions, you may not realize what there may be mistakes. At Eva, for example, we kind of address for it by having multiple error checking mechanisms in the past, both real
That's good.
after the fact, so that it at least like catches those, right, and informs you if it made any error afterwards, as well, right? And which is tough to do, and this is something not everyone does, so please be careful. Two is, as AI is evolving, it has its limitations in terms of like, I understand like people have a tendency sometimes like, all right, this is free, this is paid,
Mm, true.
uh, and I do not want to pay for it. But trust me,
Yeah.
like even when we, let's say, if we take ChatGPT, right, or Claude or others, the free version is definitely not going to be as good as the paid version. And there are
Of,
variety of reasons. It may be the same model. They may say like, oh, we have the same one. But the thing is, like, there are limitations on, the output, how much information it can retain, all of those things. And by the way, it doesn't know fully you at the same
mm,
time. So that's something that again you have to be watchful of, right? So is there is always something of a catch when it comes to that, as well. And then one final note I would say is like, as AI is evolving, right, and this is a cautionary tale, as well for our users, patients, and caregivers, and we constantly worry about this of how do we safeguard them. Is it is getting easier and easier for spammers and scammers to actually
oh,
come up with
yeah. Mm,
and kind of like use your voice, for example, right, in a very realistic setting. And so please be careful as you kind of evaluate certain solutions, and especially the solutions which you have never used in the past. I would say take it with a pinch of salt, and always consult your clinician and kind of get them comfortable, because the more comfortable they are, they understand the nuances of it, and they can actually kind of like help you navigate it. These can be immensely powerful tools, so please use them, because AI can really simplify your life. But at the same
mm.
time, make sure that you don't make clinical decisions, like let's say changing a treatment on your own
True.
without like having that
Mm.
in the loop.
I agree with what you said. I think number one, the good thing is that there's so many free AI tools right now which you can use. But number two, it's good to be mindful and watchful because there will also be cons, pros and cons of using something that's free, right? And it might not be the expertise, right? You might be getting the wrong information because again, there's a lot of research that's influenced by SEO and other kind of research tools, right? But if there's a platform with specialization like Eva, then it makes more sense to use this because this is designed for that only versus taking an AI who can just answer anything for you. Now, my other question is Eva only for caregivers and patients? Or let's say, for example, for doctors who want to keep record of their patients, is it possible for them to use the app also?
Good question. We haven't actually had a healthcare professional related release, because we are focused on more patients and caregivers. But I'm pretty sure that could be something that we can consider in the future.
Wow, that's good. But at least from a caregiver perspective, everything is taken care of in terms of, what information they need, what additional advice. It even becomes more intelligent to helping you ask those questions that you might not ask, right? Now, let's talk about what are the other things, that people need to understand with regards to caregiving because it might sound simple, right? But it's also complex. Now, both as a doctor and also into app, what is your best advice to caregivers, Saurabh?
Excellent question. And I think one of the biggest things we have seen is, and we've talked to so many caregivers over the years, is in light of caring for somebody else, right? Especially people you
Mm.
love. You tend to lose yourself, right? Because you are more kind of focused on like, okay, this is my loved one, their needs, right? Like their needs are a priority. And so, in fact, I'll give you a story of my aunt. So my
Mm.
actually passed away with cancer. So her
Mm.
cancer was detected late, much later than it could have been, because
Oh,
she was the primary caregiver of my grandma. And
oh,
so while caring for her, she kind of deferred her own cares and like, oh no, grandma is not feeling well. I'll go later on. It doesn't seem to be that much a big deal. And so, she never told anyone, never kind of like, she had doubts, but then she was like, okay, tomorrow, tomorrow, tomorrow. And so what
Mm,
ended up happening is like I actually impacted two lives right at the end of the day,
true.
uh, both
Mm,
the patient and the caregiver. And this is not just one off. Like we have seen continuously stories where people are stressed, whether you
mm,
are a primary or secondary caregiver, and it's mental stress, physical stress, financial stress. And so please be don't afraid to lean on help,
true.
because this is important to kind of like lean on your family, lean on your friends, lean on actually professionals when you really feel concerned that, hey, this may be overwhelming you, or kind of even stressing you out. It may feel unnatural, like, hey, how can I talk to somebody? I don't want to ask for help. But trust me, like there may be people whom you don't realize like are willing to help if you just kind of like say that, hey, like you need help right at the end of the day.
Mm,
And so that's, I think that's one of the most important things is to be able to take care of yourself and seek help when you feel the same as well. And I would say
sorry.
one more very quick note is, as you do that, always keep a lookout for your own future, because like,
True.
it's both
Mm,
like to it is like making sure whether it's financial, whether it's legal, that you are covered, because you may have a long road to run. You may be young one. We have seen many 30-year
mm.
caregivers too, and you cannot just lose everything at the end of the day in care of the patient. So you have to be savvy enough to kind of like look out for your own future at the same time as you make decisions along the way. So
And those are very, I'll say valid points because I agree with you. Caregiving takes a lot of energy mentally, spiritually, emotionally, financially. And if you need help, then you always have to, you can only get it when you ask for it, right? And I'm sorry about to hear about your aunt, but I think those are great living examples that, it's good to take care of others, but you also need to take care of yourself first so you can give and help more people, right? And I think that is something that it took me a while to understand, because when you're in the state of caregiving for other people, you just want to help, right? But you also fail to remember that, oh wait, I also need help, right? So that's a very critical point. Now let's go to the last question. If people want to get access to Eva Health, is this something available in the US only? If I am, let's say, in Dubai or in Philippines or Singapore, how can they get access to the app?
So our web version, which is the lighter version, is accessible to everyone. So just go to ai.eva360.com, which is ai.evva360.com, and you should be able to interact. You can create your account, and then it will get to understand more of you and interact with all the different features. Our app is only in partnership with our some specific organizations. So we are looking continuously
Mm.
for partnerships. For example, nonprofits, which may be working with the caregivers themselves, or hospital systems or insurers as well. So that one is more customized, and that is customized to the needs. So happy to chat more about that if any one is interested as well. Just shoot me a note.
Thank you, Saurabh. So, meaning on the website, you can get full access to it, but you do actually customize it specific to the needs of the organization or the hospital. So, that actually makes sense, right? Now, Saurabh, any last words before we end this podcast recording?
I think this was wonderful. Thank you so much for having me. Just one more thing is caregiving is a long journey,
Hmm.
and it is common across the world. So if you have any experience to share, please share it with me as well as others that you know about as well, because it takes a village to build things and come together, right, to take care of our loved ones, whether they need cancer care or are just elderly and need more support as well. So please always watch out for yourself as well, and would love to hear from you.
Thank you, Saurabh. So let me summarize today's episode. Caregiving is a long journey, and if you need help, the right help is there with Eva Health because they are transforming care both using AI. And I think what I love is the compassionate care, because it just takes into account everything and then gives you suggestions too. And I think the most important part here is that take care of yourself before and while taking care of others, so you can really help a lot more people. So with that, thank you again, Dr. Saurabh. I wish you all well. I wish Evva Health. I really love what you're doing, because I know it can really help a lot of people. And please go to Dr. Saurabh's LinkedIn account. We're gonna drop all his website links also. So if you do need help in terms of using the app or customizing the app for the use of your nonprofit, hospital, or organization, please reach out to him. Thank you again, Dr. Saurabh.
Thank you so much. Take care.